All right, it's time to talk with our featured guest, Steven Maroulis. Steven, how's it going?
I'm great. I
Good,
just,
good, good.
you know,
Yeah. It's Tuesday recording. Can you kick things off by telling us a bit about your business? Who are you serving and what are some of the unique things you're doing for your clients right now?
Great question. So I'm the founder and CEO of Jarvis Analytics,
Hmm.
which is a data analytics platform that has since evolved to include other workflows and DSO tools, if you will. Like 80% of our clients are actually DSOs and group practices. We also have a solo product that is geared more towards a private practice. But for the most part, we started the company with DSOs. Like my first customer was MB2 Dental. They had 67 offices February 2017 when we went live. They're at 750 offices 7 years later. So they've grown exponentially, went through two recaps, about to go through a third one. So we tend to work with group practices, emerging group practices, but also like national DSOs. We work with Ideal Dental, which is part of Decca Dental Group. We work with Smile Brands, 42 North, Elite Dental Partners. So some pretty big names, but also some smaller ones that are emerging.
Nice, man. Okay, so then majority of your clients are DSO clients. So then to you, what was the purpose of creating Jarvis Analytics?
A very interesting question because my background was not dental analytics in the first place. So kind
Hmm.
of like you, I had a marketing agency and it was digital marketing, founded in 2012, if I remember correctly. And somewhere in 2013, we were managing a lot of ad spend on high CPC areas. So like we used to do like personal injury and attorneys and things of that nature and work with yellow pages very, very closely because YP Holdings was just sold at the time to a private equity group, and they didn't have the expertise to build landing pages that convert and do A/B testing and what I call more of the performance marketing
Mm.
agency style, right? And they were focusing a lot of print and they had some very generic products. So we started working with them. They referred us a bunch of clients in the Metroplex. By a little bit of a happenstance, started working with a group in Tennessee in the Tri-Care area. They were part of the Vanderbilt hospital system. And then right after that, started working with another group in town, which was called Floss Dental. And they had
Mm.
21 practices. This is like 2014. So we handled all their marketing and we basically built an inbound marketing tool. At the time, what we were really interested in is measuring conversions and ROI, right? So the first thing I did is basically integrate with CallRail and build some kind of like a dashboard that would use a CallRail API, take every single call that was recorded and put it in a system. And from there, you could just play back calls, annotate calls, things of that nature. And that kind of like involved to capturing all the forms that were on the website because back then there was no online scheduling. Mostly it was form based. So like request an appointment. And that
Hmm.
of course would go somewhere. Typically that went to an email. And when it went to an email, it got lost. You typically have, office managers that are not in today or on vacation. And then like, something goes unanswered, right? So
Hmm.
there has to be a better way. So we evaluated using Salesforce. Or I had a really good friend of mine that I went to high school with in Greece that was heading up Click, which is a data analytics platform. And he's like, hey, I can give you Click and you can put it on the cloud and use that. And I'm like, if I do that, I don't really have anything. So we decided to build something on our own. So it was basically an inbound marketing dashboard and some workflows. And when I started working with Floss, which was my first kind of like dental customer, we got to the point where we're tracking a bunch of different things. Like we're tracking, like I mentioned, the forms and the inbound marketing. But then we started creating specialized modules and workflows. For example, direct mail. If you wanted to approve direct mail, anything non-centralized was a disaster because you'd have a marketing coordinator that's
Hmm.
responsible for 20 practices, and he'd be like herding cats. So he'd be like, okay, I want to set up a direct mail campaign. Now I have to email a large PDF to like 20 people. Then I have to remember when they're going to email me back and things of that nature. So I found a lot of operational inefficiencies, and we started building on top of that. They were using at the time a practice management system, Eaglesoft. So I said, hey, there has to be some interesting data inside the PMS because everything we were tracking was pre-visit. And I'm like, there has to be a way to track data post-visit, which was a black hole at the time. So we literally took, I think, a server and I reached out to their IT company and I said, do you mind if I take a server to my office? And they're like, sure. So they created a clone of the VM and we took literally an old Dell desktop. We plugged it in and saw the database was site-based and started like literally not hacking away, but like literally just like starting connecting to the database and understanding what data was there and building some of those things. So that's kind of like how it started. By happenstance, I'm based in Dallas and some of the big DSOs have actually emerged from the Metroplex. First Dental, then they went away. I think they were acquired by Great Expressions, but you also had Ideal Dental, which is part of Decca Dental, MB2 Dental. I met Justin Puckett, which was Floss's chief legal counsel and became the president of MB2. So he reached out to me and he's like, hey, we're at 67 offices. We have multitude of practice management systems. I know you were building that thing for Floss. Do you want to come over and like help us finish it? And I'm like, sure. So spent about a year working very, very closely with MB2 team, Justin Carroll and Puckett and Dr. V and Myra, the EVP of IT and everybody. And we basically built an abstraction layer to the practice management system. I'd like to call it more of an intelligent layer. The premise was and still is the same, which is to not centralize or consolidate the practice management system because it offers a little bit of a disruption, right? So they just wanted to leave it as is and basically find a way to extract data and make it actionable and meaningful and normalize it in a way that it can be operationalized at any part of the organization. So that's how we came up with the tagline, which was like built with DSOs for DSOs. We built the first version with flaws, if you will, the second version with MB2. Iterations came through, we worked with Ultima in Canada. Then we worked with P4D here, and it just kept off like coming and compounding and adding more clients. And in 2021, we were acquired by Henry Schein One. So I've been with Henry Schein One since, again, May 17, I think, of 2021. I'm currently the VP and General Manager of Analytics and Patient Experience, which includes basically all the, what we call patient relationship management and patient demand generation products. So that's essentially Lighthouse, Demand Force, Patient Engage, Sesame, the website, everything that has to do with the patient flow.
Okay, man. Nice. So then I know right now, if we fast forward a little bit, the latest industry trends, right? There was a benchmark report that kind of came out. So could you share some key insights from the upcoming industry benchmark report from Henry Schein One? What trends should dental practices be paying attention to right now?
Very interesting question. So the benchmark report is something that's available for sure available on our website. You can go to Jarvis Analytics or henryschein1.com and get it. And it's something that we publish annually. Every year I want to try and like publish it earlier, and somehow it ends up being like May or June. So it's kind of like mid-year. So we call it the 2024 mid-year report. So Jarvis allows you to measure a bunch of different things that relate to operational efficiency, that relate to marketing, that relate to clinical KPIs. There's something for everyone to measure. When I look at it as a business and what has recently happened, with Change Healthcare and all those things, I'm primarily interested in understanding patient flow and payments. So definitely looking at KPIs like the average new patients per month, the average appointments per day, the lead time. We launched a new capacity metric. I can come back to that a little bit later, but there's a huge emphasis on online scheduling and convenience and making dentistry more of a retail-friendly experience. So a lot of people are like launching online scheduling. The online scheduling only works if you can actually see the patient in a meaningful time frame, right? So when you see that an average appointment lead time for the bottom 10% of our customers can be like 39 days, then can you imagine if you had an emergency appointment, would you actually wait 39 days to go see a dentist? I don't think so, right? Mm-hmm. Things of that nature, like understanding, the no-show rates. Why is it that the average is 4% and our top 10 percentile is at 1%? How are they using technology differently? Because technology can help you fix a lot of those issues. And you may be asking like, how? Common sense, notifications, having a cadence to remind people of appointments, simple things like when you do offer an online scheduling, have the ability for someone to click on add to calendar. You'll be surprised. I don't know, you probably have experienced yourself. Every time I have some doctor appointment, medical appointment, they never send me a calendar invite.
Yeah.
They send me an email, then I have to remember to click on it, add it on my own. Half the time you forget it, you're in a different time zone. I've showed up to my own dentist, which is one of our customers, and I showed up 2 hours early, and I showed up 2 hours late, thankfully on the same day. But guess what? They can't see me, right? So I think understanding the patient flow, how many new patients am I getting? What is my retention? Because the practice and the health of the practice is to acquire new patients, retain those new patients, right? And treat your existing guests. But if you're licking your existing guests and you're churning your new patients, meaning like they're not active after 24 months, they just go away, then you have like a major hole in your business. Mm-hmm. So understanding those things, understanding cancellation rates, understanding collections, because we know what the production is, but do we know what the collection is? Do we know when you can hone in and understand by pay, what is the difference in reimbursement rates? What percent am I getting reimbursed? How long is it taking me? Because typically payers pay in a waterfall model, right? So how long does it take me to get fully paid? And then when you get to the clinical side, I think it's very important to be measuring both from a compliance standpoint, like do we have dentists that overdoing a certain kind of procedure? So understanding a procedure mix, that everybody has a healthy procedure mix. Like if you're saying anomaly in your data, like why is somebody doing more crowns? Does it make sense statistically that within 50 or 700 practices, one particular dentist does 10x more crowns than somebody else? That doesn't make any sense. That understanding those things, understanding warranties and procedures, right? How often do you have to go back and redo certain things? I think these are just some of the KPIs that we can track.
Interesting. So real quick, we rewind something that I guess is an industry-wide headache is the no-show rates, right? You mentioned the cadence of it, notifications, the following up. In your experience, watching the analytics, what's the most optimal way to do this?
I think it largely depends on your demographic. So if you know that somebody lives within 15 miles of the office and they typically work, they have a regular job, you offer them now an appointment like Tuesday 9 a.m. Are they likely to show up? Can you see in the past if they've had that kind of appointment? Now, if it's an emergency, it's a different story. But for regular recall, right, you need to be more cognizant of targeting the right people at the right time. That's one. Two, I think you can double click and understand payer performance. Like, is it a certain no-show rate from a demographic standpoint, from a payer standpoint? And then I think technology can enable you to lower those. So, for example, what we typically say with recalls is a month before a reminder, and then 2 weeks, and then 2 days, and then the day off. That's what I typically see. And I know that some people might be like, oh my God, I'm getting so many texts, but those texts remind you that I do have an appointment and I should show up. And those definitely reduce the no-show rates. In some cases, being able to cancel an appointment online or reschedule. Many physicians or, dentists are not interested in offering those kind of canceling online, right, or rescheduling. Or it might be a very complex procedure, something that requires 2 3 hours, you can't just on a whim go and reschedule it. But I think offering more options, notifying the patients well advanced in time, several times, these are some of the things you can definitely do to definitely reduce the no-show rates.
Gotcha. Okay. I can see how some practice owners will be like, why would I give them that option, right? But
Right.
it's beneficial. So you're not just having a huge gap in your
So you
schedule.
know that somebody's not going to show up exactly, you can go fill it right well in advance versus leaving it last second. I think that's definitely one of the considerations.
I like that. Okay. So then what are the top metrics? Would you say the top 2 or 3 that they're underperforming in? And then what strategies would you recommend to improve it?
So that's the interesting thing from a clinical KPI standpoint. I think that's what I've heard from working with a lot of chief clinical officers. It's like you can't go to a dentist and complain about production or collection on adjustments. What you can do is you can provide the metrics to show them why the production is lower than others. Things that could explain that would be, for example, treatment planning and treatment acceptance. We measure treatment acceptance both from a procedure standpoint and a dollar standpoint, and we measure it on the same day, 30 days, 60 days, 90 days. Now, obviously, the more time goes by, you're not likely to show up. But understanding why is it that somebody's not showing up or the production is not high enough can be attributed to treatment planning, to explaining why the treatment planning is necessary. Because you go to your dentist, I've been very lucky, knock on wood, that like I've only had tooth extractions when I was like younger, right? But I had no cavities, no. But every time I go to the dentist, I'm always thinking like, okay, something happened. Like, how would I approach it? I don't know how I would approach it. Like if somebody said to me, oh my God, you have to do a root canal. Would I be like, oh, do I need a second opinion? Do I want to see AI show me that I need that?
Yeah.
Am I going to call my friend, like one of the, DSO owners, and be like, hey, this is what happened. Do I need it? The average consumer that doesn't have access to this or is not very well educated, you're in pain and you show up and then somebody says you need to do like these procedures. Financing is an issue, we see. You offer an ability to finance the procedure, right? Do you have an in-house plan? Do you offer a discount plan? These are all things that can affect production. But ultimately, from a coaching standpoint, is looking at clinical KPIs and understanding basic things like the procedure mix of the patients, no-show rates would impact production, treatment acceptance would impact production, understanding the period of proofing. Is that a healthy number? The average we see is 24%, and yet the top 10% are in the 70%. So there's a huge discrepancy between the low performing or the average, if you will, and the top 10%. And that's what is really interesting to look at the report, because you will see some like amazing differences, like average time to payment, 20 days, top 10%, 7 days. What is it that is different, right?
Yeah. Interesting. What is it that they're doing?
Well, I would imagine that like when you double click on that and you look at the data, they probably have more centralized business offices that do eligibilities and make sure before the patient comes in that they're fully eligible for the procedure. And then like obviously the claim is sent properly with the necessary images and x-rays and clinical notes, and possibly they're working directly with the payer or the higher level of reimbursement and things of that nature.
Yeah. Would you say the top 10% in that area, they have more specific roles?
More sophisticated. That's one of the things we're saying, right? One of the things we struggle with. If I'm a solo dentist, I know clinical, I went to dental school to become a really top physician, and I know clinical and I understand empathy and I understand, how to do the procedures, but nobody has taught me how to run a business. And this really is a business. So when you see those groups forming and consolidating in the DSOs, all they're really bringing to The play here is essentially a very well-defined oil machine, if you will, that includes people, culture, technology that can take advantage and maximize, I don't want to use the word just profits, but maximize and improve every single function of that business, whether it's marketing, whether it's front office, operations, finance, collections, aging. They're just very well defined. They understand data and they act using that data. So they don't make guesses out of gut feeling.
Yeah.
I was telling somebody the other day, like we keep thinking that after the Change Healthcare incident, that the environment, the copay collection is going down and it's challenging. And when we actually looked at the data, and maybe we'll sympathize because as a consumer myself, I just bought a salad. The salad last year was like, I don't know, $9 and now it's like 14.
Yeah.
So there's definitely an inflationary aspect to it. But I think when we actually ran the data, it was actually really interesting. We're like extremely bullish on the dental profession. We saw a reduction in no-show rates from 7% to 4%. We saw, significant increase in copay from 75 to 84%, substantial rise in production for hygiene provided per day. And we saw steady traffic or flow of patients. We didn't see the big crash that happened during COVID, where you had like essentially clinics shut down for like 2 months and then it adds up like exponentially. We see a steady increase of patients. We see an increase of reimbursement. We see a decrease in the time to get reimbursed. From our standpoint, everything seems like very healthy in the industry.
Interesting. That's good. That's reassuring too.
And it goes back to what I always say. I'm like, from a marketing standpoint, I always thought December is the busiest month and the highest production month. Because to me, in my mind, in December, we always run use it or lose it campaigns. Yeah. Maximize your insurance, make sure you use it, right? Use it or lose it. I remember doing that for every single DSO. I wanted to pull in some data. December was not the highest month. The highest month production-wise was March. The slowest month was August. The second slowest month was December.
Interesting.
So it's really interesting because, again, it shows that like data is impartial and data doesn't lie. It's just data.
Yeah.
So in our mind and my mind and possibly your mind, if you're coming with a marketing background, you keep thinking like, oh, I'm very busy because I send a lot of mailers, I send a lot of ads, I increase my spend. In reality, that's not what happens. And that's why it's very interesting, both for the solo practice, but obviously the DSOs and the group practice, to look at the data, mine the data, understand the data, and then operationalize that data to make it actionable and not get overwhelmed, which everybody can get overwhelmed. Like if I give you Jarvis right now, you'll be like, oh my God, there's so many things you do. Take a breather. This is a baseline. And now let's work with our customer success team to figure out like what can be improved and how. Gather a plan for like 30 days, 60 days, 90 days. Maybe you don't deploy to your front office and overwhelm them with something now. Maybe you just focus more on the back end. You focus on RCM functions. You focus on operations. You focus on finance. And then you roll it out to your front office and teach them how to properly use a tool like Jarvis.
I like that, man. I like that a lot. So then right now, what are some of the common misconceptions about analytics in a practice management, right, that you encounter? How do you address those?
I think the first one is like literally, let's say you have no analytics and you install Jarvis and then you go to the doctor or the hygienist and be like, hey, look, you're not doing so well. The first thing is going to be like, it's the economy, the schools are closed, the insurance is not paying us enough and fast enough. They're going to find 10 different reasons as to why something is not surfaced, not to be. Right? And they're set in their mind. And I think then when you go back and present the data and say, well, look, the last 12 months, 24 months, 36 months, this is what it looked like. This is the number of procedures. Procedure count went down. New patient visits went down. Retention went down. Leading indicators that result in lower performance. So I think the first thing that happens when you install something like Jarvis and you start looking at the data is this kind of like shock of like, oh my God, I thought I knew this. And in reality, that's not the answer. That baseline is very interesting.
Just like you said, like August was the slowest. You would think September, right? Like everybody kind of goes along with that. And then December, we think it's like,
but it's not.
Yeah, but is it productive though? That's interesting. Okay. So then how can practices leverage patient data to predict and meet patient needs more effectively then?
I think it's being able to understand, what the data is telling you. So like, if you look at like retention as an example, and most groups measure retention as 18 months, some groups measure it 24, but I think the industry average is like 18 months. That basically measures and says, if Michael came to my practice January 2024, has he come for his recall all the way up to June 2025? That will consider you an active patient. One visit or, every 6 months, 3 visits. If you see that dropping, that tells you something. It can't be that like everybody's moving out of town and you're no longer the dentist of choice. It tells you that recall system is not working. Most likely you left the office without an next visit appointment. It tells you your reminders are not working because you didn't notify the patient. It tells you that maybe you dropped an insurance. payer, right? And that's not accepted anymore. I mean, there's always answer to the data. We even provide some really cool maps that you'd love from a marketing standpoint. We take Google Maps and we put a pin where the practice is, and then we'll create a heat map that shows you patient concentration within proximity to your practice. And then we add another dimension, new patients, existing patients, and then payer type, production collection adjustment by payer type. So that can give you some really insightful data, not only on how to operate your business, but also how to market your business. So you don't just run, citywide campaigns. You can now focus on particular zip codes. If you know particular zip codes and payers are much more profitable, have lower no-show rates, then it only makes sense to maximize your investment in those areas. That's kind of what data equips you and allows you to do.
I like that. So then looking ahead, what in your eyes are the next big changes or innovations in analytics that you predict will influence practices in the coming years?
I think one of the things that I'm working on and everybody's wanting is like right now, the data, you just have to pull it. I mean, you can schedule reports, email reports, morning huddle, end of day, you can automate a lot of those things. But for the most part, it requires somebody to go to Jarvis and go to a particular module and filter the data and pull it, like they have something set in their mind and they're validating it. I think the next step is to actually fully automate that. Like I'll give you an example. We have a treatment planning module, TX Minor, that shows you not only stats about pending schedule and unscheduled treatment and acceptance rates, but it also shows you a working list of patients and their pending unscheduled treatment and the payer. Right now, we manually allow someone to go select that and then send them an email or a text or something. I see that being fully automated. My vision for patient experience and analytics includes basically not having a front office. Not in the bad sense that I'm here to eliminate jobs. I'm here to make their jobs easier. If you go to a practice, right, you see the front office does 10 things. They check you in, check you out, capture the payment. They make sure you have your next recall, like a lot of manual tasks that should not be happening in 2024. So I see a lot of automation on one hand, and I see a lot of AI use in the terms of coming into a tool like Jarvis and being able to select a stream. And then using that stream, the software does it for you. So if I want to improve clinical performance, we know there's a decision tree behind it that can affect the behavior. How can we automate that? So picking streams and areas of focus, basically, I think is going to be very, very interesting. Fully automating everything where you don't have to touch anything, I think is very important. There's conversational things that we worked with that you can actually ask questions. I mean, we built something with ChatGPT as a proof of concept that allows you to basically, ask your own data. So instead of just going to pull a report and compare to practices, you can say, hey, well, what were my top 2 practices in the Metroplex? And then why? And we'll just continuously evolve, drill data and graph it for you. We launched something called KPI Builder, if you will, that you can go build your own KPIs. Within 1 week, we saw 180 KPIs being created by customers. Is that an insane amount of KPIs? Absolutely. Do you need to track 180 things? No, you can go back to basics. But if you're on that 10th percentile, you're running out of things, low-hanging fruit things to optimize. So now you start narrowing the focus and doubling down on edge cases. And I think that's where it's very, very useful.
Yeah. And so the low-hanging fruit would be what again?
Production collection adjustments, new patient retention, things of that nature, very basic behavioral things. If I see that my production every year is decreasing or every month is decreasing, it's probably related to new patient flow and retention. Because you assume within a population they have the same procedure mix.
Yeah.
It can't be that you're in a case where everybody in an area that everybody does Invisalign and nothing else, or just crowns and nothing else, or extractions and nothing else. You assume that there's a healthy mix of patients that come in, existing and new. So I think it's a function of caring for your patients. I make it sound like it's all analytics. I take for granted that you're going to have clinical excellence. You're going to have a good doctor that's going to be compassionate, going to be really good at what they do. And I think the data will show you that.
And I'm sure you've seen this, Steven, where we get hyped. We're like, oh my gosh, I can track this. I can track that. I can do all this, right? Practice owner gets hyped. Team gets hyped, maybe the management team. But for a practice looking to deeply integrate analytics for the first time, what are the first steps they should take and what pitfalls should they avoid to not just be super overwhelmed and then it doesn't go anywhere?
Having a focus, I think, is very, very important. And our team and our customer success team can help bring that focus. Part of the sales process or the pre-sales, if you will, we'd also ask them to say, what are your pain points? What can we help you improve? We also have a consulting team internally that sometimes we pair up with Jarvis. So you can actually buy a consulting team engagement plus the tool to help you track that. So I think that definitely helps. So having a focus, having an expert definitely helps. The third thing is the change management. And that's where I see a lot of failures. It's like not being open to change. So it's kind of like me and you arguing about, if I tell you that like December is not the busiest month, and you're like, no, 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 I know it is the busiest month. I'm like, well, here's the data, tells you it's not the busiest month. Like, no,
Yeah.
no, no, I'm convinced it's the busiest month. I'm not willing to change. That's when I think the biggest multiplier is being open to unemotionally look at the data, understand that there's areas of improvement, and use the tools to improve that.
I can see how that's tricky for a lot of practices, but their team, right? Where they're like, I know we were busy. We had a ton of people and everything. And then they're like, no, that month sucked. Look at the analytics. And I'm sure you've seen this where the team's like, that thing's wrong. There's something wrong with that thing. What do we do in that scenario?
It's really interesting. You just go back and reaffirm that the data doesn't lie. And we've had this. I mean, I remember at the very beginning, I was working with the chief training officer at DECA, and he would be like, we're tracking an average appointment time. He'd be like, why is this showing now 2,000 minutes? There's something wrong. Like, how can it be? We came to find out nobody had like actually checked out the patient. So as far as the PMS was concerned, the patient was still there and having a procedure. So if you're using the PMS data, it's like garbage in, garbage out. Now, is it possible to fix all the stuff from the PMS? Potentially. But when you look at the data will show you something like this, and then you can go fix it. Because otherwise you wouldn't know. In that particular instance, I want to say that like somebody at the front office or, their clinical provider, I don't remember, it was like 3-4 years ago, forgot to actually check out the patient in the practice management system. So therefore, the metrics were wrong. So I think edge cases like that, you can potentially identify and you can see it because it's glaringly obvious on Jarvis.
So sometimes it's human error. Sometimes the user can kill the analytics. And then
100%.
it just...
Yeah, 100%. If you look at, for example, I mean, you're on marketing. I mean, I'm sure you look at the referred by, which is typically a free field, and anybody can type anything, right?
Yeah.
So it's like Google with 2 O's and 2 G's. Sometimes like Google with 1 O, Google, like other apps like internet. And then you're sitting there as a marketer and you're like, okay, I'm trying to understand the patient referral flow, and I get this list and nothing is standardized. So we help with a lot of that too. There's data mapping tools inside Jarvis that helps you clean up that data or at least identify that it's not normalized and then go fix it. But yeah, unfortunately, we're relying on the practice management system for a lot of that data.
I can't tell you, Steven, how many times that happens. Like internet. Do we pay our SEO company more? Do we pay our Google ads more? Social media? How do you sharpen
one
that?
of the first things we built actually right after Jarvis was an add-on module. It's kind of like a marketeer's dream. We call it marketing matchback. And in layman's terms, it's just first-party attribution. When you're running PPC campaigns, right, whether you're running on a fixed bid or eCPM or something, which typically most of them now running on a dynamic bid, Google measures conversions and they know that somebody clicked and they know that somebody either scheduled or filled in a form or made a phone call. But then anything after that is a black hole because Google doesn't integrate with the practice management system. So we actually built a system that takes the data, sanitizes it, checks it against all the locations. And you'll be like, why do I need to check against 175 locations? Well, because people do silly stuff sometimes. And you might run a campaign at the geo level, like in Dallas Forward, and you might have 50 practices in Dallas, right? In which case, you don't know where the patient is going to go. So it's better to go and measure everywhere versus just check a few offices. We capture the UTM parameters, assuming that the marketing agencies set them up correctly and they're running campaigns, which it's a no-brainer, but assuming they do that, we say it on Jarvis, and then we take the data, we sanitize it, and we track it for 60 days. And we can tell you first visit, production, lead time by channel. So you can see things that, again, instinctively, it can be validated. Like, for example, the lead time from Facebook tends to be much longer than the lead time from Google. Mm-hmm. Why is that? Well, I mean, Facebook is a social network, and you might run a campaign, and I might click on it, and most likely it's going to be ortho or braces or something to that nature. On the other hand, Google is more like, let me search, I have a tooth emergency or like broken tooth, something. So it's much more instant. Yeah. That's an example of like, what I had in my mind and what the data showed me was actually accurate. You start to understand the patient flow. And now if you add on your cost, you understand ROAS. And if you understand ROAS, then you can go optimize. We also have the ability to feed back into Google the conversion data with a dollar amount. So now I know that the G-Click ID, this particular G-Click ID, X amount of production. Now I can fit that, and if I'm using dynamic bidding, it can improve my targeting. Google will not tell you, but they do have a pretty good correlation between demographics and Google Click IDs. Same with Facebook. We have a proper attribution model that allows you to look at the data and not have to rely to this erroneous way of like, hey, how did you hear about us?
By the form, yeah. Interesting. Okay. So then right now, when it comes to leveraging these analytics, how can practices use analytics, not just for day-to-day business operations, but to drive strategic business decisions and growth?
once you deploy something and you start fixing the low-hanging fruit, then you can start experimenting. When I ran an agency, the first thing we did, which at the time nobody did, and I still don't see it being done, is we run landing pages for particular payers. We run particular landing pages for employers. So your targeting now can change. So again, if I have an issue with new patient acquisition, I go to operations marketing module within Jarvis. I look at my practice or my cohort of practices. I look at the heat map and I draw correlation between distance, first visit production, and payer. And I also look at the employer, which is very, very important. Grassroots, employer is one of the low-hanging fruits. And one of my friends is like, the son of Fred Loya Insurance, which is it's a big insurer in the United States, primarily, for the Hispanic kind of like Southern market, if you will, right? It's a tremendous source because, they have a lot of employees. And I said, have you reached out to them and set up a referral program? Make yourself aware. So we had a group that had practices near Fred Loya offices that they went and ran grassroots campaigns, and that skyrocketed their business.
Yeah.
Understanding what payers you have in your vicinity and your practice vicinity, I think is very important. Nobody's doing that.
So Jarvis can do that?
I mean, we can help you unearth the data. We can show you the data, and then you can go around the campaign. But it's kind of like hard to do it if you don't know what the data tells you. How Jarvis can help you is like definitely on the marketing side, super low hanging fruit, especially for me and you. You'd love like getting in and looking at some of the data and see how you can actually create your website, change things. Yeah, we actually launched online scheduling 3-4 months ago. Actually, we've been live for quite some time, but 3-4 months ago, we launched a partnership with Google. So we offer Reserve with Google right now, which integrates the scheduling solution, the X1 scheduling solution powered by Jarvis or other products natively into your Google business profile. Not only gives you a book online button, but it actually gives you a services tab. And the services tab is your actual appointments that you've opened up in the calendar and offer available for booking. And those drive local search. So traditionally people type dentist near me, but you might type emergency dentist near me. Well, if you have one of your appointment types as emergency, new patient or existing patient, then your result will come up higher. Google is all about experience and click through. So you have Reserve with Google, you have a book online button, the feeds we provide to Google daily, Google search, that's part of the search program, would move the results much higher. So something like that can be a huge differentiation to your new patient flow.
Yeah. And we can do that manually already right now? Wow. Okay. That's really helpful. So then one of the last questions I wanted to ask you is, throughout this process, can you discuss a case where detailed analytics led to unexpected business insights or growth opportunities for a practice?
One of our customers, MB2, and also Floss at the time, we're running Invisalign days. Invisalign days were very special targeted offerings, right? That were offering basically come in anytime, do a consultation, maybe some kind of like discount. So we did two things for them. One, we experimented with price elasticity. This is pre-Jarvis, right? As an agency, we ran campaigns that measured the discount, $1,000 off, $1,500 off, $2,000 off. And in certain demographics, we saw an inverse correlation. In affluent demographics, the higher the discount, the lower the conversion. Those people associate a big discount with crappier service. That was the first thing I saw, which was interesting to me. Second thing is we allowed them to optimize that by going to TX Miner, the module that we have, and consolidating in aggregate, depending on scheduled treatment plans that included Invisalign. So now we can actually target more effectively and more completely the entire patient base versus just like creating a fake day, call it Invisalign day, and then hope for people to show up and market it. Now we're very targeted in our marketing. And same thing we did with Invisalign, we can do with every single procedure that's pending scheduled treatment, crown extraction, whatever. So if you really think about it, being able to understand what you have in the PMS and then use that from a marketing standpoint to create either an online offer, landing page, or an actual open day for the practice, I think can have a significant impact in revenue production.
In the practice management software, the consultations that you had that maybe people clicked on but didn't come in, or they did come in but they didn't pull the trigger on it and all that stuff, you gathered that together.
And then we'll provide that to the marketing team and run a campaign using one of our, PRM tools, right? And we do that with online scheduling too. Like we've added certain things on online scheduling that nobody else has done. The ability to verify an appointment. So you can write it immediately into the database, or you can text them to verify, text or email to verify. Well, the verification, which is basically a double opt-in, happens within seconds or minute at the latest. We allow them for 90 minutes to confirm. After 90 minutes, the appointment is gone and we free it up for somebody else to take it. So simple things like that can definitely alter and affect behavior and can guide the patients to a certain outcome to reduce no-shows.
Interesting. Could I ask real quick, with that Invisalign day, specifically the ones that already came in but didn't pull the trigger, what was the incentive to have them come in again on that specific day and, hey, we're doing this?
I think it was just their whole practice was essentially freed up. So they had a number of operators and doctors. It was like a very dedicated day to Invisalign. The intent was like essentially, it's a high dollar procedure, $2,500 to $4,000, whatever the going rate is right now.
Mm-hmm.
Can we maximize it and run a huge campaign behind it so that we can target the right people to come at the right time to close those scheduled treatments?
Yeah. Interesting. Okay. Awesome, Steven. Thank you so much for your time. But before we say goodbye, can you tell our listeners where they can find you?
They can find me in LinkedIn, Steven Maroulis. My email is steven.maroulis@henryschein1.com or steven@jarvisanalytics.com. Happy to help, happy to talk. Looking forward to working with you and other practices.
Awesome, man. Steven, thank you so much. And that's going to be in the show notes below if you want to reach out to Steven. And Steven, thank you so much. And we'll talk to you soon.
Thank you.